It's never easy as a GP to look after a person who has been involved in violent crime.
Just my main concern. I mean, if they're just going to leave it like that, which I'm hoping they're not, because I can't stand the sight of it.
Delivering difficult news to patients is never easy, and I don't think it ever becomes easier. Just to be clear, this clinic would be a clinic for people who we suspect may have a potential cancer, OK?
Forming a good relationship with your patients is one of the cornerstones of good general practice. The sooner you can give birth to this and get this out, the better. That's muscle, is it really?
Most people have six-pack, I have a barrel.
And I feel such a brat. You say I've got gout, and everybody thinks that's funny.
Barnum Surgery has been to Pam. How can I help?
Hello, good morning. Thanks for waiting.
Thank you.
Hello, Sandra. My name is Dr. Bajola. How can I help you?
On Tuesday,
Oh, my
I
goodness.
was on a trip and a wasp stung me in my eye, like just under my eye. And
Yes.
instead of getting better, it's getting worse and worse.
Yes.
Ambulance came, but
All right, okay.
they just gave me paracetamol and stuff, and that was it.
When was that?
Tuesday
So
Tuesday
you
night.
had a sting by the bee, is it?
Yeah, it was.
And after that, you were swollen like this?
Yeah,
Straight away?
yeah. And
Yeah.
it's just getting worse and worse. Like yesterday, I could open my eye, but now I can barely open it.
Yeah. What I want to do, I want to take a temperature. I want to look into your eye and obviously feel that place, and we take it from there.
Yeah, it's really numb.
Yes. Okay. So where did you go?
Newlands Park.
It's nice, isn't it? Yeah. So I can see there is a bit of... Does it hurt when I touch?
Yeah, just a bit like around
Okay.
here.
Yeah. So, obviously the place where it has stung, there's too much space in it. So that's why a lot of fluid get collected in it very quickly. Obviously the ibuprofen you're taking, which you take 2 tablets 3 or 4 times a day, you need to continue with that. Antihistamine, you're going to continue with that. But I'm just wondering if there is any infection, I should give you some antibiotics as well.
Only she's allergic for penicillin.
I wouldn't give penicillin then.
Yeah.
Obviously, if you start having high-grade fever, persistent vomiting, then you need to go to A&E. Yeah? Okay? We call it cellulitis then. Then it's something different and you need something in your veins. Yeah? All right?
All right, thank
It was nice meeting you and good luck.
Yeah.
Yeah. Yeah.
I'm going this way, Alison, whilst you fight with the wasp.
Where's he gone?
Alison, you're going to really annoy him.
He's all right.
Well, it's very difficult to concentrate on consultation with him in here. Oh, God.
I'm through. How are you? Appointments for him?
Yes, not bad.
Good. All right, so how can I help?
And he was sweating a lot in bed.
Yeah.
And in mornings, his stomach was basically soaking wet.
Yeah.
And he had a bit of a cold on him and cough on him.
Yeah, I always have coughs now. And my mummy have bleeds.
X-rays.
Yeah. How long has all this been going on for?
Sweating been over 2 weeks. Coughing is
You
bad.
can take
Been
your
a
jacket
month.
off. It's not raining.
Okay, Dorian, darling.
All right, let's have a look at him, and then we'll talk about the X-ray, and then we'll decide what we're going to do. Dorian, let's have a look at you, darling. All right.
What's that?
What is this?
Yeah.
It's a torch.
For your ears.
Yeah, your ears and your throat. So say ah for me. Big ah, show me your tongue. I can't hear you. Say ah. Good boy. Oh, is he bringing anything up with the cough?
Yeah.
Okay.
You see any water in that today or not?
Do I see any water? No. Can I see anything growing?
But when I drink
No.
water, it makes the sound in, but the water goes in my ear, but it goes all the way down.
Does it?
Yeah.
So when you drink water, it goes in your ears?
Yeah, I found it goes all the way down
Wow.
to my mouth.
Wow, that doesn't sound right. Okay, can we have a listen to your chest here?
Yeah.
Okay, good boy. Some deep breaths. Okay. And
About
turn around
my
facing
back?
me. Oh, yeah, I'm coming onto it. I'm coming onto it. Come on. All right, and again. Keep your mouth open, darling. Okay. All right. What the chest X-ray shows is that actually just in some of his airways, they just look a bit thicker, and that can sometimes happen when you've got build-up of mucus in the lungs and the airways. So it may be that he's just harbouring an infection, but because it's gone on for so long and he's been having the night sweats, it's probably best treating him with some antibiotics to see if it settles it down and clears up the congestion that's inside. So are you okay for him to have some antibiotics?
Yeah.
Yeah. Is he allergic to anything?
No.
This is your medicine, Dorian.
I hope it's going to be okay.
Yeah, let's see. If afterwards things aren't settling down, then come back and see us. Okay.
Sticky things on my shoe. Look.
Yeah, you do. Oh.
Yeah.
Okay. So you've stepped in something mucky.
Another one. Let me check. Nope.
Then
Only a little bit.
Then Mum had to clean your shoes.
Here.
Thanks, Abby.
All right, all right.
So thank you to the doctor.
Thank you.
You're welcome, Dorian.
Good boy.
Do you know, after my lunch, I'm going to go to the police station.
You're going to the police station? What? Have you been a naughty boy?
No, but just playing with the police station mans and ladies.
Oh, okay. All right, you make sure you have fun then, okay?
Yeah.
All right, bye-bye.
Where is he? Damien. Hello, mate. I couldn't see you there.
Sorry, buddy.
I didn't recognise you because of this little nice shaved head at the back here.
Got a bit close to it.
Yeah. I think you did. Come and take a seat, mate. How are you getting on?
Well, so really. I'm still getting a lot of trouble with it. It keeps swelling up. I just can't physically do the things that I really want to do, and it's frustrating the hell out of me now.
Yeah, I'm sure it is.
It's driving me mad. Like today, I was kneeling down, and I went to stand up to walk off, and it was just complete agony. I had to stop for about 5-10 minutes. It feels like I'm being electrocuted and burnt at the same time.
That's your nerve damage.
That's all the nerve damage, yeah.
Damien was the victim of quite a nasty assault about 10 months ago. He was set upon by a large number of people outside of a pub in which his leg was broken, both his tibia and his fibula, then came through the skin, causing a very nasty wound. The base of his leg was held on only by some of the soft tissue that was left. Well, I think a couple of things as well. So don't forget that you've actually lost muscle bulk on here.
Yeah, from here, round there. I mean, because this bit's still stuck to the bone. I don't know what they're going to do about that.
Looks like, you've had a shark attack.
Yeah, I thought someone's taking a chunk out of it. Yeah. I shouldn't really be so bothered about it, but it does wind me up with people just staring at it, when you're out. And it's just completely...
You're on some sertraline at one stage. Are you still taking that, or...?
Well, yeah, I am, yeah. I need to get some
Do you want to get some more of that? Because you'd probably just about run out in any case, yeah?
Yeah. And I need you to do me another note if you can.
Yeah. I'm happy to. What were you doing work-wise before this?
I was mobile mechanic.
Yeah.
And I just can't do it. I've got the job centre breathing down my neck, obviously trying to force me into work.
Yeah, they will.
And I've tried explaining to them that it's not a case that I don't want to go to work.
Yeah.
I do want to go to work, it's just that I can't do my job.
Damien ended up having two operations. The first one was to take away all of the mangled tissue and the dead tissue, to clean up the bones and insert a very large metal rod all the way through his tibia, his main bone in the leg. 2 days after that, the plastic surgeons took over. So I believe the idea is to try and even it up, to hopefully take away some of the pain and to make it cosmetically a lot better to look at. This is where you need to go in with all your questions.
Yeah.
Write them all down and say...
Well, that's just my main concern. I mean, if they're just going to leave it like that, which I'm hoping they're not, because I can't stand the sight of it,
That
I'll
doesn't
say-
seem to be the case there. It
Yeah,
looks to me
they're
as
not
if
gonna
they're
do-
looking at flap revision and to redo some of that.
Yes, it is getting rather frustrating. It's got a lot better though. Honestly, it's got a lot better.
Well, it has, and you know, you're lucky to still be walking. To be fair,
Yeah.
or walking with two legs. So you know. There you go, buddy.
Thank you.
Okay, mate. Let's see how we get on. Yeah.
Yeah.
So
Onwards and upwards.
yeah.
Okay.
Okay, mate.
Lovely.
See you later, buddy.
Cheers, thank
You
you.
take care, mate. Yeah. Bye bye.
Hi, come on in. Nice to see you. I'm Dr. Tawana. How are you? You're not feeling too well? No. Okay. I'll have a look at this in a minute. Tell me what's been happening.
So about a week ago, I woke up and started feeling some tightness around this whole, there was a band across. And then a few days later, I started feeling more sharper pains around here. And then also began feeling short of breath sometimes.
Yes.
So I could be just sitting and then all of a sudden I'd be out of breath.
Yes.
Or I'd feel like a shock.
Like a sharp pain?
Yeah.
So it catches you suddenly?
Yeah.
So movement, maybe?
Yeah, sometimes movement, sometimes staying still.
Yeah.
Sometimes just breathing, it hurts.
Sure. Any pain in your calf muscles of the legs? Yeah?
Yeah, when I stretch them out, they sometimes lock up.
Yeah.
Very painful.
And is it both sides?
Mainly left.
Mainly your left. Okay, all right. Now, can I have a listen to your heart, and then we'll listen to your lungs?
Okay.
Let's have a listen just here. Pop that down there. Take a big breath in for me.
As you walk through there, Cindy, and all your hair was all like a little bit babe station.
Photo shooting for babes.
Yeah.
Go on, Cindy. I can't do it. I ain't got any. Oh, God.
You'll have to shake something else.
Oh, God, no. Knock myself out.
You give yourself a black eye.
I know I would.
Yes, please.
Bill.
Yes, still running bikes.
I've got a young doctor with me. Is that okay? You coming in? Yeah. This is Dr. Shah.
Hey, try.
We haven't had this row for a couple of years now.
It's Butch Maxie.
It's not even a full-face helmet.
It's hot out there. I've got to be able to breathe in the air. It helps me oxygen.
Should we talk about Graham? Who nearly died?
Yeah.
On a motorbike?
Yeah.
Bill is one of the reasons I love being a GP. I've looked after Bill and his family for the 17 and a half years that I've been a GP. It's been a real pleasure and a privilege. I'm genuinely concerned that Bill is still riding a motorbike, probably because Bill's own son, Graham, was seriously injured in a motorbike accident a few years ago and is still left with the consequences of that motorbike accident. Anyway, how lovely to see you.
Yes, thanks, Dr. Morris. Right, that is the readings.
So check his blood pressure. Yeah. Okay, come on, have a... Yeah. Okay, so what do you think of those readings?
They're not too bad,
Yeah.
actually.
Yeah, you see, 140 over 105. Because I wind you up and...
Yeah.
You know. So are we going to go with the home readings or the surgery readings?
The home readings.
The home readings, that's okay. We encourage patients to do their own blood pressure readings because we've got plenty of evidence now that blood pressure readings taken at home are lower than in the surgery. Also, it encourages patients to take an interest in their blood pressure. So it's all about, I think, informing patients and empowering them to take interest and responsibility for their own health. So we're going to carry on with the medication as it is, and we're just going to say that that is, you know...
I'd like to live a little bit longer.
You and me both. About you. Yeah. Obviously, the sooner you can give birth to this and get this out, the
muscle.
better. That's muscle, is it really?
Most people have six-pack. I have a barrel.
You have a barrel? Yeah.
That's why the girdle's there.
Is that right? Yes, to hold it. Yes, I didn't. Yes. See how much better your back would be if we weren't carrying around a 9-month-old.
it's solid.
It is solid. It's solid fat.
No. Fat wobbles when you run. I can't even run, but there you go.
Men tend to have what we call apple obesity, which is when they have most of their fat around the abdomen. And ladies are said to have pear-shaped obesity, where they have most of their fat at the tops of their legs and on their buttocks. Bill clearly has central obesity. And the fat that you can see is also around his liver and his heart.
On the fitness programme, I ride more. Well, if I'm riding, I'm not eating, see, that's why I eat.
OK, yeah.
So, like,
it's called false logic, that, but yeah.
So, okay. Have you done with me?
Yes, thank you. It's nice to see you.
Yeah, appreciate that.
Yeah. Thanks for telling me what to do.
Yeah, so
and I think your blood pressure, if you can check it a couple of times a month, will be fine, really.
Yeah. Right, awesome.
OK.
It's nice to meet you.
Nice to meet you too.
Yeah, right, yeah.
Cheers, Bill. Take care. Thanks, Joey. Bye-bye.
Bye-bye.
Someone shoved chewing gum. Please don't let that be chewing gum under that desk, because if it is, I think I might cry. What? I swear that better be blue tack.
Where?
Turned into a bit of a jam before you working in a doctor's, didn't you?
Take a big breath in for me, and then out. And now hold your breath. Fantastic. Do you mind if I press on the middle of your chest there? Please tell me if it hurts. That's uncomfortable, is it? OK. That's hurting there as well, isn't it? OK, fine. Can I get you to do this? Stand up for me. What we're going to do now is, can I get you to pop your hands behind your head and then turn one way and then the other? And when you do that, does that bring the pain on? Yeah? Yeah. And what about hands down here? And we get you to do the same again. So turning left and right. No. No, but you felt it certainly when you did that one. OK, take a seat again. OK. I think I know what's going on. And thankfully, it's not serious. What we have here is our rib cage, OK? And the bone in the middle is called the sternal bone. Either side of that, where the ribs come off, you've got some cartilage joining the bones all up together. And if we've had, for example, a viral type of infection, sometimes that virus irritates in this area and it causes a condition we called Costocondritis, which means there's a bit of irritation and inflammation going on here, which is why you've been feeling the way you have. So how we treat this, let's just have a look. Are you OK taking medicine like ibuprofen? Yeah. The reason I ask about medicine like ibuprofen, it is the best medicine to try and settle the irritation and the inflammation going on here, as well as giving you some paracetamol or recommending you take some paracetamol. So if I prescribe you those bits, we'll get you to take them over the next 3 to 5 days. I'm pretty confident that that's going to take the edge off things and help settle this down. Okay. You start taking this medicine and you feel worse, then please come and see us. All right. OK, there you go, Saeed. Thanks. Take care of yourself. Get well soon. Thanks. OK. Thank you. Oh, you're welcome. Take care.
I've come to make a prescription. Yeah. Joseph Kurklu, Kurklu.
Is it in there, is it?
Yeah, I think this is one I brought down earlier.
It should have just been done by the doctor a few minutes ago.
If you want the prescription, will it be in there?
Oh, right. Is it a prescription, sir? If you can just do us a favour.
Yeah.
Can you go up to room 17 and see if there's a prescription ready?
Hello.
Hi.
Please come and have a seat, Dr. Bolger. Just let me get your notes up. Dr. Allen's patient, yeah? Yes. And how can I help this evening?
I think I've had a blood clot.
Where?
My leg.
Right, OK. And have you been to see anyone?
No, you're my first.
Right, OK. Let me have a look. Oh, right, you've got some bruising, yeah?
Came across really warm yesterday, with severe pain, and then...
And then that appeared?
Then that appeared.
Right, I need to examine you properly. I need those off, I'm afraid. Is it still painful?
Yeah, very.
Right, OK.
I have had PE before, but I was pregnant, so I sort of know what it was like from last time.
Right, OK. So is the leg swollen?
Only in that place.
Just around that vein, yeah?
Yeah.
So hopefully it's vein rather than arterial. OK, can you lie down for me? Nothing down in the calves?
No, but I had one on here a couple of weeks ago that went.
OK, so that you're bruising more easily, yeah?
Yeah.
OK. So this came on yesterday, yeah?
Yeah.
And you're not on warfarin or anything like that now? From the point of view of risks, the main issue with a clot is where it is in the body. So a clot in the vein in the leg will cause symptoms. It causes quite a lot of pain and discomfort, but it's not dangerous from the point of view of where it is in the leg. It's dangerous in that it can break off and cause problems in the lung. A clot in a blood vessel in the lung or a clot in the vessels that supply heart tissue can be very, very much more serious.
That's really sore.
It's very tender, isn't it? So that looks like a superficial thrombophlebitis, yeah? Which is where one of the smaller vessels gets blocked and it gets tender and inflamed and a bit warm around it, yeah? There's nothing in the thigh itself. There's no redness there that I can see. Was this red yesterday? Because it's not now. It's not been red at all.
No, it really itched afterwards.
Did it?
It was
Right.
really strange. It just really itched.
So I don't know if you remember from when you had your clot in your leg, or was it just in your lung?
Lung.
Right, so you never had anything in your leg. OK. So what you would expect is you'd expect swelling, you'd expect redness. There's no swelling, there's no redness. You would expect it to be tender, and it is, but just over that localised bit there. So hopefully this is something superficial, yeah? Rather than something systemic.
Yeah.
You said you had another one. Where's that?
So that was on here.
So you've been popping them, have you?
I reckon, yeah. So I have B12 every 8 weeks, and that tends to... So if I don't have it frequently...
You bruise more easily then?
I bruise more easily.
Your B12 is up to date?
Yes.
Then we should check your full blood count, OK? Check your platelets, check there's nothing going on. Does that make sense as a plan? Come back across. If it continues to settle down, then obviously that's fine. But any suggestion it's moving the other way, you call straight away.
Carry on. I'm OK working?
Yeah, you're fine. What do you do?
Yeah, I'm facilities manager, so...
Yeah, that's absolutely fine. That's better than sitting around, yeah?
All
Keeping mobile, yeah?
Yeah.
Can you come in tomorrow morning for a blood test? Tomorrow morning? OK. Now, the result will come back to me. If there's any issue with the result, I'll be in touch with you. I'm going to check your blood count and I'm going to check your clotting, yeah?
OK.
If it is all fine and it settles with some pain relief and we don't find any underlying cause, then you just monitor. But with this leg, if there's any suggestion it's moving the other way, you're getting any swelling, any redness, anything that suggests there's something going on deeper, we need to see you, OK?
Yeah, brilliant.
Yeah, keep a close eye for us, yeah?
Yeah, we'll do.
Good.
Thank you.
Bye-bye.
Melissa Lambert.
Hiya. Hello. Right, so I've come in, basically. I got discharged from Frimley 2 days ago for quite a nasty infection that I had. And just leading up to that, I've just had loads of illnesses, like one after the other, for the last 5 months. And didn't know if there's anything else going on, whether there's some vitamin deficiency or something with the immune system. So I'm a bit just concerned with it, really. Got quite ill and had to be admitted overnight this week.
So what was the infection?
Tonsillitis.
OK.
And then, so it's the second time I've had it.
OK.
It's just that every single month I've had something going on, whether it's kind of chesty, usually throat related. But then with high temperatures and everything else, and just feeling run down all the time, to be honest. And yeah, I don't really know.
Is there any reason why you should be run down or short of vitamins?
No, not really. I've never had any problems. So all the other kind of previous years, I maybe get one thing a year, and I've had about 5 in 5 months. Like every single month, I seem to just pick up something, and nothing's really changed. So
You're not in a new job?
No, I work in a hospital.
You're full of sick people. You're bound to catch things.
Exactly. Yeah. Well, it's not changed. No, no, nothing seems to have changed.
So what do you do in the hospital?
I'm a physio.
Okay. So I think we should do a chest X-ray.
Yeah.
I think we should do a full blood count, check your liver, your kidneys, check you for diabetes, check your thyroid, check your vitamin B12 and folate and your iron levels, but not do a vitamin D because you're not dark-skinned. You've already had today's dose. You know, it's unlikely. Really, vitamin D, anybody who's colour skin like you, it's going to be low, so you need to have vitamin D supplements. And you and I need them in the winter. Vitamin D deficiency and insufficiency is quite a hot topic at the moment. We know there isn't enough sunlight in the United Kingdom for patients with pigmented skin to make vitamin D pretty much throughout the year, really. So the advice is that patients with pigmented skin should think about having a vitamin D supplement every single day. I think fair-skinned people who get sufficient sunlight exposure during the April to September months, which is probably 20 minutes a day, don't need to take a vitamin D supplement during the summer, but that they should seriously think about having a vitamin D supplement every day on the October to March months. Okay.
Lovely, thank you very much.
Hope you get better. Hope you come again.
Time. Yeah, fingers crossed.
Take care. Nice to meet you. Bye-bye.
Oh, I've got a cramp in my foot.
Well, take your shoe off and walk around.
And my feet are red, bright red, because I've got that lurgy.
Don't come near me. You can stop the allergy anywhere else, love, not me here.
It's not contagious.
How do you know?
Because I know.
No. Are you a nurse?
The doctor has told me. No, the doctor has told me it's not contagious.
Yeah. I don't believe you. You're going to pass your lurgy on to everybody, aren't you? And
shall I go home then?
I said no. We'll go home and you sort it out.
Kacper Massa, please. Hello there. Come in, come in. This is Kacper. Grab a seat, Kacper. Do you want to sit there? Right. What can we do for Kacper? Is this a bit of a giveaway?
My hand hurts. Basically, the ball hit here, then it's starting to hurt here.
Right, okay.
It hurts.
It hurts there.
It's pain or?
Yeah, it's pain. Okay, you can see that's sort of swollen, can you?
Yeah.
And also, it's a little bit sort of bent here. Now, children, is that sore there? If I do that? Children's bones are very bendy. He may just have bent it or he may have a little crack in it, but I think given that how swollen it is and that it's still sort of quite sore, I think we need to get it x-rayed.
Yeah.
So what I'm going to do is I will put the form for the x-ray on the system. You can take them up to x-ray today, anytime now.
Okay.
They will x-ray it, and then if there's a problem with it, they will normally say, we need to put something on it, and they'll send you to A&E straight away then. But it's quicker to do that than just say, go up to A&E.
Okay.
Does that sound sensible?
Yeah.
Okay.
Okay.
But I think he might have a little break in it or a crack. Or certainly he looks as if he might have bent it.
Uh-oh. I'm scared. Why?
No, you don't need to be scared.
There's nothing wrong. I should be scared, not you. I'm scared of you. Something's going to happen to you. Makes sense? No. No, it doesn't. And I know it does. Don't worry. Doesn't.
So if you go up to the X-ray department, go up anytime now. The form is on their system.
So, Mummy, now we're going after this?
Now we're going.
Yeah. In the meantime, just get them up there, get it done. If it's still sore and there's nothing extra broken, paracetamol is probably a good thing to help with this.
Okay.
Okay. Right, young man?
Thank you very much.
You're very welcome.
Okay, thank you.
Okay, you're very welcome. Take care. Bye-bye.
Have a nice good day.
And thank you very much. Bye. Bye, Kacper.
Bye. Bye.
I went home and had a massive lunch at 12 o'clock.
What do you eat?
The biggest tuna and egg salad you've ever seen in your life, and then 3 slices of cheese.
Tuna and egg?
Yeah.
Mixed together?
Yeah, but hard-boiled egg.
Ew.
It was nice. Are you bloody over that?
Egg and fish?
Yeah.
I suppose that's what
But
you eat
egg and
in
anchovy
Spain,
work.
isn't it?
Yeah, but egg and anchovy works. I love anchovies. They're those really salty small fish.
You're disgusting.
And then
do you
today
like sardines?
I love fish.
Whitebait is just dirty.
Yeah, but whitebait, you just deep fry it straight away.
Is that what they deep fry and like put into chunks?
They like to put it in... No, whitebait is tiny, so I mean, you can eat the bones. They're so soft.
Just I think they do those in Bella Italia.
Probably. Whitebait.
Mr. McGarvey? Hi, how are you?
Yeah.
You all right?
You don't need it.
Let's have a chat.
Okay.
Yeah? You getting on with the new medication, okay?
Yeah, we've done it.
Yeah.
Yes.
Good. Okay. So, if you remember, we mentioned because you were found to be anemic.
Yeah.
We wanted to kind of check if you were deficient in iron, most importantly, and you are.
Okay.
Yeah. The other test we did do was your prostate test, which was normal, was within normal range. So that's reassuring, but we need to talk about this iron.
Okay.
Because in men, iron deficiency causing anemia is not really that common. And if it does exist, we usually want to investigate it to find out what's causing it.
Okay.
So there are lots of things that can cause anemia. If you have chronic conditions, like you've got diabetes and other things, sometimes that can make you anemic. Iron deficiency in men usually doesn't happen for natural reasons, as it would do, for example, in women when they have their monthly period. And so it usually means that there is an underlying disorder that perhaps we need to look for, whether that's a disorder such as inflammatory bowel disease or celiac disease, where they're not absorbing the iron, right through to more worrying causes. The iron deficiency bit sometimes makes us think of other things. Sometimes, for example, in the bowel, you can have growths sometimes that can cause small bleeding that you could lose iron from.
Mm-hmm.
And that's one of the things that in my mind, I'm thinking we maybe need to look at and consider whether we need to refer you, actually.
Yeah, let's do it.
Yeah. One thing we sometimes do, and we often like to do when you get blood tests like this, is examine the back passage in the clinic today.
Okay.
Is that something you'd be happy for me to do?
Yeah.
Yeah. So what I'll do first is examine your tummy, and then we'll examine the back passage as well. So you don't have to lower everything straight away. If you just show me your tummy first.
Okay.
Excuse my hands, they're very cold.
Yeah.
And is there any history of any bowel problems in the family, bowel cancer
no.
or anything like that? No. Okay, that's fine. If you just lower your bottom things, and I'd like you to roll over to face that wall and tuck your knees up into your chest for me. Okay, just take some nice deep breaths for me, okay? If it's too uncomfortable, you just tell me to stop. You'll feel a bit cold. Okay, I'm all done. So, examining your back passage, everything feels normal. I can't feel any lumps or bumps or anything there that feels concerning. But like I said, I think we need to do some more investigations. What I think that should be is a referral to a clinic in the hospital and make sure that there's nothing that could be causing this anemia. Okay? So, just to be clear, this clinic would be a clinic for people who we suspect may have a potential cancer.
Daniel Bridger, please. Hello.
Hello.
Come and have a seat. So you're here for your asthma review today, Daniel?
Yes,
Yeah, any problems?
I still get a bit wheezy every now and then. It's not too bad. I do get out of breath sometimes, like, I don't know why, it's just random, but I always like to have my blue inhaler there, just
Good.
sort of. I usually do it before I go to bed because it sort of helps me relax almost.
So how often are you using your Ventolin then, do you think?
Like once a day.
Once a day?
Yeah.
Okay. So that would be seen to be using it quite a lot then. So if you're using something to relieve symptoms of asthma more than 3 times a week, then really you should be on a steroid inhaler.
Right.
Okay. So,
I don't know. I don't think I need it.
you don't think you need the steroid?
No, I don't really want it. Really, I just don't like. It's been on them since I was a kid, so it's just like trying to work my way off that. You know?
Let's just do your peak flow and just see what that's like.
Yeah.
Big breath in and then just blow out really hard and fast. Oh, that's good. Okay, it's about 470.
Is that good or bad?
Your predicted peak flow is 560. Okay, so it's a little bit lower than it should be. With asthma, what you get is symptoms of airway inflammation.
Yeah.
Then the only way of treating that is with the steroid inhaler. Okay.
Yeah.
Now, also, I'm going to give you one of these. Okay.
So kids have.
Yeah, simply because if you're using this in the mouth, okay, even if you've got the best technique, okay, you only get 8% of the medication.
Okay.
If you use this through here,
Yeah.
you get 80% of the medication. Okay. So use your brown inhaler through this.
Yeah.
And I can understand as a young man when you're out and about, you don't want to carry this with you, but make sure you take your blue inhaler with you. Okay? And do you smoke, Daniel?
Occasionally.
Occasionally. How occasional do you smoke?
No, more than I should.
Okay. You're not going to tell me?
No.
Right, so you...
I'm trying to quit.
Yeah, good. Right, okay. Well, that's good, but it's good that you're thinking about it and trying to cut down, so that's good.
I've got the patches at home ready to start when I'm ready.
All right, so you just have to...
Hopefully Monday I'm motivated to start.
Good, lovely. That's fine then.
Cool.
All right, I'll just get this signed for you. So if you just want to wait in
here.
Or you can wait there if you want to wait in the... Yeah, just wait here and I'll get this signed.
I'm not sort of saying for any second that I think this is a highly likely thing, okay? But I think it's something that we need to at least rule out. If you have the test, they find nothing else there, then at least that's reassuring. And then we need to find another reason, potentially, why you're iron deficient, okay? And normally, they see you within 2 weeks. So it's quite a rapid access thing. They'd normally let you know in about a week's time. And then they normally fact through the results. Once they've seen you, once they've done the tests, they normally let us know. And then again, we're seeing you regularly anyway, so we can catch up on things.
Okay.
And obviously, if any questions arise in the meantime, then always just pick up the phone and leave a message for me. I'll call you back before you see them. Is that all right?
Yeah.
Okay, and we'll catch up again in about 3 weeks' time.
Yeah.
All right.
Okay, thanks a lot.
Take care.
You got a new den again. I know. They keep switching me around. How you doing? You all right?
Yes, thank you, love.
What can I do for you?
I'm struggling with this gout.
Are you? So the allopurinol not helping?
Do you know what?
Or you're not taking?
I am fed up with cherries,
Yeah.
cherry tablets, cherries, you name it. The only thing I haven't gone on to is celery yet.
Okay.
And that's the other one that's good for it.
Okay.
Your blood pressure was good,
Everything was good.
was it?
Blood pressure's really good. 123/75.
So I've got another year or so then.
I think you've got a bit more than that. Let's just have a look at the allopurinol. I think we can up the dose of it.
I could hardly walk.
Okay.
And I feel such a brat. Walking, you know, they say, what's up here? And you say, I've got gout. And everybody thinks that's funny.
Why is it funny?
Well, it's an old lifestyle, isn't it? You only got gout if you drank port. Have you not heard that?
Yeah. We will need to keep an eye on your kidney function with this. I don't think we can increase it while you're on it. I don't want to put your allopurinol on repeat, to be honest.
But it is on repeat.
Yeah, it's on repeat, but I don't want to put it on... I don't want to give you 6 months of it, because I do want to see what your kidney function's doing.
Does it affect it?
Can do.
Should I carry on eating cherries?
Yeah, definitely.
Thank you kindly.
No problem. Take care.
Thank
Good
you
to
for
see
your time. Look after yourself.
Yeah, no problem.
Thanks for your time.
You too.
Thanks, lovey. All right. What's a good feeling?
See you later.
Yeah.
Bye-bye. Okay, bye-bye.
Thanks very much.
Nice to see you. You take care, okay?
Bye-bye for now.
Final surgery, Nikki speaking. How can I help?
Mr. Bunting? Right. Sir, come in.
About 2 weeks ago, I got a little black lump underneath my tongue.
Right.
I just want to find out what it is.
And it's stayed the same since you first noticed it?
It's got a little tiny bit bigger, but it's not massive. It's just...
OK, I'll have a look. It's just the light.
Oh, right.
OK? Take it open your mouth. Right. And it's not causing you any pain? And
I'm a bit worried because I had a tumour took out there.
OK.
So how can I help today?
It hurts. I had labour and it's worse than that.
Okay, worse than labour?
Yes.
That must be the worst thing imaginable then. I can't imagine anything worse than labour.
It hurts. My stand up is easier. It starts from there,
Yeah.
goes round,
Uh-huh.
down there,
Uh-huh.
and to there.
Okay. And that's been since...
Tuesday.
Did it come on gradually on Tuesday or did you suddenly...
No, I just woke up.
You woke up with it on Tuesday and it was
Yeah.
like that? You hadn't done anything on Monday that might have caused it?
Nothing, no.
You weren't out digging the road or...
No, I was behaving and
No,
I wasn't
no.
swinging from any
No.
trees and stuff.
Right, not...
No.
Okay, yeah.
Took 2, what are they, naproxen, and I
Uh-huh.
took 4 paracetamol.
Took the edge off it, didn't touch it?
Nothing, no.
Nothing? And pooing and wings okay?
It's fine, yeah.
Okay. Right, let's have a look at your legs. Well, wait, back first of all. Just stand up for me. I can sit down. That's okay? Yeah. Okay, can I lift this up?
Yeah.
Okay, so whereabouts does it hurt?
There.
There. Okay. Does that hurt?
Ah, yes.
Oh, well, yes then. Does that hurt there?
No.
But that hurts that side there.
Yeah.
So all the way across there.
Yeah.
And then down here, does that hurt?
No.
Okay, so can you touch your toes? How good can you get? My glasses.
Oh, there.
Okay, how far back up can you come? How far back?
Oh, no.
No?
No.
Can we lie you on the couch? I just want to lift your leg in there, is that okay?
You've got a step in.
Got a step? I'll give you a boost if you want.
Okay, one moment, bear with me.
And you did mention that in the past you'd had to have something removed.
They called it a Warfin tumour. W-A-R-F-I-N. Warfin.
Wartin's tumour, there we go.
Oh, it's got a T in it, has it?
OK, so I'm just going to go in and just sort of feel this area that you mentioned. When I squeeze it, it almost seems to disappear in terms of the colour and then it returns. It almost feels like a blood vessel in the area.
That's what the wife said.
Did she?
Yeah.
OK.
And I
Okay.
thought it was going to disappear on its own, but it hasn't. And I'm just a bit worried
Sure.
as to what it is. But
OK. I mean, even the thing you had before was a benign sort
Yeah,
of thing, and it wasn't sort of a cancerous thing which could potentially spread. So I don't think there's any association between this and what happened before in 2005. Can I just check the glands in your neck just to see if there's any enlargement? It's fine. And you've been well otherwise?
Yeah.
Any weight loss at all?
This is it, yeah, I've lost quite a bit of weight. The wife says it's down to eating better, but I don't know. I mean, I haven't lost an appetite.
Has she changed your diet?
And she's retired now, so
Right.
it's a lot more healthy food.
Can I check your weight? You can leave your shoes on if you want. It won't make it.
I would do, but they're still toe cap. I think
Sometimes,
I think I've gone down to about 15 stone or so.
It's actually the same.
The
As
same?
what it was in January.
Oh, it must be the scales at home then.
Going back to your this thing under your tongue, personally, I would say I don't think it needs removal at this stage. From my estimate of looking at it, it measures about 2 millimeters in diameter. If it doubled its size, I would want this to be looked at a bit further. But I think we can watch and wait for now.
Nothing to worry about then.
No. Okay?
Yeah, that's fine.
All right.
Okay.
Take care. Bye-bye.
Thanks very much.
See you.
Bye.
Is that hurting?
Yeah.
When I do that, where does it hurt? In the back. How does that make you feel when I do that?
Oh, yeah.
Makes it worse, yeah?
Yeah.
That's Benjamin there. Is that okay?
Yeah.
Okay. Just sit you up. Okay, just swing your legs around. Just come have a seat.
Oh, what have I done?
Okay, right, so this feels like the muscle in the back. It's a very common thing. It's the commonest cause of backache probably is the muscles. And being as we are upright on 2 legs, and so 50% of us will get backache at some point, and often we don't know what's caused it.
No.
Yeah. As uncomfortable as those chairs are, you need to sit in an upright chair, not in a lounge chair, because it curves your back. The treatment is not to lie down and rest. The treatment is to keep mobile, but not to bend and not to lift. The warning signs of backache are numbness on the bit of your bottom where you sit on the bicycle saddle, or if you can't wee, or if you're incontinent to poo. That's that's what we call a red flag. That's straight to hospital. Don't pass go. Don't collect any money. Just go to hospital. So, shall I give you some cocodamol, which is codeine plus paracetamol?
I'll take anything.
Will you?
To get rid of the pain, yeah.
Okay, so you can take naproxen with these, okay, but you can't take paracetamol with them. Keep moving, and if it's not better in a week, you'll probably be seeing you again. But if you've got those red flags.
I will do. I will do.
Nice to see you. Take care. And you. All the best. Bye-bye, Sue. Bye-bye.
Hello. Bye-bye.
Hello. How are you?
Hello.
Hi.
How are you?
You did it again. You did the weird hello.
Oh my God. They keep moaning about my hello. Was it that bad? Did you like my hello? Hello.
Hello.
Who comes out? Hello. That's not my fault, is it?
Are you okay?
How are you?
Yeah, not sure bad. Okay.
Good.
It's all right.
Well done for coming to see me.
Okay. Blood test or?
Yes, completely. I was going to call you, but then I realised you had an appointment with me, and I thought I'd wait and see to see if you attended. So this is your cholesterol level. It's 5.7. Okay.
Is that low or?
That's high.
Is that high?
But this particular type of fat, it's called your triglycerides, is really high.
Mm-hmm.
The normal range is 0.45 to 1.82, and yours is 7.6.
7.6.
But 2 years ago when we spoke to you,
Yeah.
it was 14.
14 was
So
it?
it has come down, but it's still really high.
Yeah. Sometimes, I've been to the parties, things and drink and eat too much, mutton, so fat food.
Okay, with this particular type of fat, called your triglycerides, if it's really high, you're at risk of causing inflammation to your pancreas, which is the organ which secretes insulin, okay, which controls your blood sugar levels. So we do worry about it, okay? How would you feel about starting some medication? Because this is all a risk factor for heart disease, putting you at increased risk of developing a heart attack or a stroke. You need to understand that this is putting you at completely high risk, and we need to try and control it and bring it down. So yes, your diet is really important. You need to cut out the fatty foods. You need to cut out the fried foods. Try and do some more exercise.
Yeah.
Do you smoke? Remind me.
No, I'm cut down now. Sometimes smoke 1 or 2 a day.
Okay. And how much alcohol are you drinking?
It's nearly quarter bottle like that. Quarter cup bottles. Whiskey like that.
I'm sorry, a quarter bottle?
Yeah.
Okay. For you, because your levels are so high, I think you need the help of medication as well. Are you willing to give it a go?
Yeah.
Yeah?
Oh, yeah.
Okay. I want to start you on a low dose to make sure you see your body gets used to them. Okay, and then we'll do a blood test in, say...
6 months? Oh.
Yeah, in 6 months' time. Okay, to see how you're getting on with them.
Okay. Thank you, yeah? Take care.
Bye-bye.
Bye.
Thanks for coming in. Is it because we've been pestering you to come and see us?
Yeah. Basically, you said I had to come and see you before you could issue me a sick note.
Yeah, because I wanted to see you, catch up with you and see how you are. Yeah.
Well, I'm not too bad, to be honest. I'm still a little bit depressed and I'm not getting no help from nowhere. And my Crohn's disease is still the same, but I ain't getting no help because I can't take tablets. So it's not getting no better for me.
Okay, so talk me through not being able to take tablets.
I went in hospital, I had pneumonia, like I never took tablets before that, and they tried crushing them up, everything, and I just kept throwing them back out, just won't go down. Like, it's just a thought of it.
It's a psychological thing.
Yeah, I don't know why, as soon as it goes in my mouth, I just throw it back out. Like, I got so bad, they had to like operate on me to get the fluid out of me. I had to use like a drill to drain to like my lung and take the fluid out that way.
So this is having a big effect on you then? You're not getting better because of it?
Yeah, no.
So tell me how your Crohn's disease is, as you're not having any medication.
Well, that's quite bad, to be honest with you. I go to the toilet like a few times a day.
Uh-huh.
And when I got to go, I literally have to go.
What, it's stand back, I'm coming through?
Yeah, like if anyone's in there, they got to get out.
Okay. And is it loose?
It's never been like solid, it's always been like water.
Okay.
And it stinks.
Yeah, okay. And any tummy pain or?
No, not really.
No? And how's your weight?
Before I had the operation, I used to be like 16 stone, I used to be pretty big, and I went down to like a stick.
And can you tell me about your diet? I mean, do you have to watch what you eat, or can you?
No, I don't. I can't eat dairy products or anything like that. I've been told that much, but I ain't been told nothing further than that.
Have you seen a dietitian?
No.
Right. Okay. Would you like to?
Yeah, I would. Yeah.
Okay. And then you said about your mood.
Been an ongoing problem, and like I don't have any motivation to do anything. Even like when it comes to having a conversation with someone, like I find it hard sometimes. I don't know what to say in that. I just gone really low esteem, I suppose.
Do you feel bad about yourself?
I do sometimes. Like I get like bad thoughts about myself, but not all the time.
Okay. What are these bad thoughts about yourself?
I don't know. I just like feel like not wanted and stuff like that.
Like not wanted.
Yeah, like things like that.
Lily Ellis. Hi, morning.
Hiya.
Okay.
Okay. I'm going to Greece on Tuesday.
Okay.
And I'm due on my period that day.
Okay.
And I just wondered if there's any tablets you could give me just like the pill, just while I'm away.
Okay.
Because I don't really want to be in Greece.
Where are you going?
Crete.
Nice. How long are you away for?
2 weeks.
Okay. So when was your last period?
The end of last month. So I'm due on.
So you're due on any time?
Yeah.
And can I ask, are you using any contraception at the moment?
I'm a lesbian, so.
Okay.
Yeah.
All right, so you don't need any contraception
No.
cover?
No.
Excellent. All right. So in that case, and because it's such short notice,
Yeah.
there is something that we can give you.
Okay.
You're going on Tuesday, did you
Yeah.
say? Okay, so I would probably start taking it on Saturday.
Okay.
Okay, just so
Yeah.
that you take it 3 days before you're due to
right,
start
yeah.
on. And then take it for the time that you're out there, and then you need to stop as soon as you come back, because we don't normally give it for more than 2 weeks.
Yeah, that's
okay,
fine,
that'll be
yeah.
slightly later. For now, this will be okay, and you
Yeah.
don't need to worry about contraception,
No.
so that's okay. I prescribed norethistrone for Lily, sometimes known as the period delay tablet. Norethistrone is a synthetic form of the female hormone progesterone, which is responsible for maintaining the lining of the womb and prevents it from being shed. So this medication can help women that want to delay their period for some time. It can also help women who suffer with heavy, painful periods. It can have some side effects, such as bloating, nausea, breast tenderness, and it can also have an effect on women's cycle after they stop using it. The tablet is not known to have an effect on ovulation or the fertility of a woman. So when you come back and you start your period, things may be a bit abnormal for a couple of months. That's just the effects of the hormones and the
All right, that's
pills.
fine,
Okay,
yeah.
so don't be alarmed.
Okay, that's fine.
So start taking this from tomorrow.
Okay.
1 tablet 3 times a day. Okay.
All
Have
right.
a great time.
Thank
All right,
you.
See you then. Bye-bye.
Do you feel like hurting yourself?
I did once, like I cut my arm there,
Uh-huh.
but that was about 4 or 5 months ago.
Okay. So nothing recent.
No,
and,
nothing
and,
recent.
and any thoughts about committing suicide?
No.
Do you drink alcohol?
Sometimes,
Okay.
but not all the time.
So how often do you go out for a drink?
Well, I've been out for about 2 months.
Okay. Do you smoke?
Cigarettes, yeah.
How many?
About 10 a day, 11. I'd love to stop because it's so expensive, and
Yeah.
but I just every time I try, I get 2-3 hours into it, then I have to start smoking again.
What? Okay. Would you like some help with that?
Yeah, I would.
Okay. So I arranged you to see our smoking cessation clinic here.
Yeah, that'd be good.
Okay. And do you use any illicit drugs, cannabis or anything
No.
else? No.
No,
Okay. Right.
I couldn't afford it.
Okay. Put on the scales. No. Okay, that's 75.
How much is 75?
That is about 11 3/4.
For a day, a lot, is it?
So I'm much, as a doctor, for your height, happier with you being 11.5 stone than 16 stone. Yeah. And then I wonder about getting you to go and see talking therapies to A, look at your depression.
Yeah, they were going to send me to that.
But also to see if we can help with this not being able to take medication issue.
Yeah, that's a big issue.
Okay, so that's 4 things. Dietitian, smoking, talking therapies, and gastroenterology. Okay, Michael?
Yeah.
You can read my scribble. Okay, thanks for coming in. Okay, take care. Bye-bye.
I've got sausages, I've got sausages. And then she went, baked beans. I want to sing now, because you maybe want to sing, but I don't want to sing. What sing? What sing? What song? What sing is singing?
Wheels on the bus go round and round, round and round, round and round.
Now, it's time for the appointment.
Come on in, Maria.
Thank you.
Through. So, I saw you last week, didn't I? Week before?
Just over, yeah, week before.
Doesn't time fly when you're having fun?
It certainly does.
And we did loads of bloods, didn't we?
We did.
Because you're struggling with your back and I'm struggling with your back, yeah?
I'm struggling with everything. It's not even just my back. My toes hurt, my arms hurt, my shoulders, my collarbone, you name it, and it hurts.
It hurts. Maria has been having problems with her back since the late 90s. She's seen physiotherapists, she's seen pain clinics, and she's seen orthopaedic surgeons. She's had repeated scans which have shown some disc damage and more recently some wear and tear of the facet joints. In 2013, the surgeons tried a decompression, which is where they took the disc out and they fused the vertebrae. But unfortunately for Maria, it hasn't really worked. I did some bloods to look at how your immune system was working, and one of them was just a little abnormal. Nothing. The lab are basically saying we don't know if that's anything to be concerned about or not.
Yeah.
And it should be repeated in 3 months. There's certainly nothing that's jumping out of those bloods, but we can't leave you like this, can we?
No.
Maria has been diagnosed with fibromyalgia. Fibromyalgia is a collection of symptoms. It's a syndrome. To diagnose it, it really needs to have been going on for at least 3 months. Patients report widespread pain, tiredness. They also have problems sleeping, and they describe memory problems, so difficulty in thinking clearly. It's moved from just your back, which is where we just
I
descended to.
literally feel like I've been hit by a bus some days. I can't sleep. The pain is waking me up. I'm miserable.
There are 2 options, I think. The first is to get you off to see a rheumatologist to explain that things have changed and for them to check that they don't think there's anything that we're missing that we should be treating. I may well have to go back to the pain clinic because I'm struggling to think what else we can use.
Whatever you recommend, I'm happy to go with.
It's very frustrating, very difficult when you see a patient whom you've worked through all the usual treatments that you would offer for their pain and you're really not making any impact on it. It's very distressing for the patient and very disappointing for the doctor.
Everything hurts. Fed up with moaning. My lot I must be driving them insane.
Hi, how are you?
Okay, I don't know if you had the A&E report. She fell back onto the floor while she was playing with her dad off the sofa. I can't even remember how long she was actually not breathing for. She went blue, rigid, and fell. And then a couple of weeks later, she did it again.
Okay, so what?
But it wasn't as bad.
What happens?
You know when you're crying, but you don't take a breath?
Yeah.
She just didn't breathe. She went blue.
How long does that last for?
It felt like it was forever, but I think it was probably 5 minutes, the whole process. When she did come around again, she was slurring, she was still woozy. But once she made it to A&E, within like half an hour of being in A&E, she was back to normal again.
Right. And that was that one episode?
That was that one episode. Then it happened a couple of weeks after. She went from her room to her brother's room, slipped on the floor, and her brother went off on her. And I was like, what's wrong? What happened? But Safa's not breathing.
Wait, did you see that long breath pause or anything? Or was it
No,
just
but her brother saw it.
Okay.
I know he's only 4, but he's quite aware, because he was there when it happened the first time.
Okay. Did she actually go blue the first time?
She went blue, lips, face, everything was just blue. It was horrible.
So what you're taking at the moment?
Gabapentin. Can you actually do my prescription for me while I'm...
So you're on duloxetine, gabapentin, amitriptyline.
I'm not taking the duloxetine.
You didn't like that, did you?
It gave me really bad nightmares and made me sweat like a workman.
Okay.
It wasn't pleasant.
So let's get rid of that.
I tried. I couldn't persevere with that one.
No, that's fine. Have you been on patches?
No.
That's another option, isn't it?
I'll try anything at this point.
When did you do the talking therapist pain management stuff? Was that recently?
No, it was quite a while ago.
Right, but you're happy with it? You know what you're doing with it? They give you sort of exercises.
Yeah,
and things,
you
don't they?
get exercises. To be honest with you, I think the I can't remember, is it psychologist?
Psychologist, yeah.
I don't think she liked me very much.
Why?
Because she kept talking about think positively through your pain. And I was like, I completely understand what you're saying, but with all due respect, if I've got a physical problem causing the pain, all the positive thinking in the world isn't going to take that away. And because she couldn't argue, I don't think she liked me very much.
Sure she did, but yeah, I mean...
But no, I get all of that.
The results were good. Prescription's gone. We'll wait and see what the rheumatologists think.
Okie dokie. Yeah, great. Thank you very much.
No problem.
Have a good day, and you.
Bye-bye.
Bye-bye.
How are you feeling, sweetheart?
I'm all right.
You weren't looking good at all.
I ended up with shingles.
Oh, God, that's so terrible.
Yeah.
Poor kid.
So I was like 4 weeks ago.
Oh, no. That's the worst. Anyway,
Still
that's a
How are
love.
you getting on?
Rosie said to fetch my car just packed up today.
All right, sweetheart. No problem, darling.
No, it sounds like this could have been what we call a breath-holding attack, okay? So sometimes what happens is kiddies can hold their breath, go blue, and it can be very, very dramatic and obviously quite distressing for the parents. There are two types of breath-holding attacks, and they're divided into blue or white. Blue breath-holding attacks are far more common and essentially occur when the child is in pain or frustrated or angry. The lips may go blue and they lose consciousness. With white breath-holding attacks, they're also known as reflex anoxic seizures. It usually occurs after a sudden fright or a sudden onset of pain, for example, a minor head injury. They will go pale, limp, and there will be loss of consciousness. Occasionally, they also look like they're having a seizure where their limbs will go very firm and there can be some shaking movements. What I'm going to do, I'm going to examine her, of course, now. What I'm going to do is I'm going to put you into my colleague who's essentially got a specialist interest in paediatrics. I'm going to get her to review and make sure that she's happy with the history as well. Does that make sense?
That's fine. I just want to check there's nothing long-term.
Absolutely, absolutely. No, of course. Pop her on your lap for me.
Go on. Go a bit more like that.
Okay. And lift it up right up for me. Let's have a listen to her chest. Spin her around for me. Good, okay. So since the third, she's been back to her normal self, running around, playing active, no concerns?
Yeah.
Good, okay. Breath-holding attacks are not a sign of anything more sinister. However, occasionally they can be confused with epilepsy, which is why it's important to seek immediate medical attention if something like this occurs. If, of course, an episode recurs, you've done absolutely the right thing. I'm sure in A&E they showed you the basic things that you should do. So if it does recur, make sure you seek immediate medical attention. All right? Lovely. No trouble. All right, bye-bye now.
Your lights are on.
Thank you.
No worries. And that's good observancy.
Good observancy. Is observancy a word, though?
I don't know.
I bet you used to say millennium as well, didn't you?
Who?
Millennium for the millennium. Millennium.
Yeah. Can I help you?
Okay, come in. Have a seat.
I've been given these tablets.
Yeah.
And these. And I'm also taking Citalopram. But I haven't been given, they haven't been put on my repeat prescription.
Okay.
So I haven't taken them for a month.
Which one have you not taken?
Both all of them.
Right, okay. Whilst you're here, it would be an opportunity to just check if anything's changed since you were last seen.
No, nothing's really changed. It's just I just don't like.
Because you used to take olanzapine.
Yeah,
now you're on this.
yeah, I'm on that.
And do you think there's been any improvement?
There's been a little bit of improvement, but as I said, I haven't had them for about a month now.
Okay.
And everything, I'm getting all these thoughts back in my head.
Right. Robert suffers with schizophrenia, particularly psychosis. He suffers with symptoms of hearing voices, as well as symptoms of feeling quite low and depressed. This has developed during his 20s. He was someone who was functioning quite well. He held various jobs during his life, but unfortunately he went through difficulties. He wasn't able to function. So he started an antipsychotic medication. During the time he was on the medication, he became type 2 diabetic. Okay, if you ever get into a situation where your medications aren't there, and, you know, they say there's no appointment, somehow or another we need to contact you even on that day so that at least we can sort it out. And usually we can see you even as an emergency or do it over the phone. And then with the diabetes side of things...
Last week, when I had a hypo, my blood sugar level was at 2.4, and I checked it 2 hours later, and it managed to get up to 2.6.
And were you taking these tablets at that time?
No, I wasn't taking them. No. Because that's what I said. I run out of them. I ain't had them for a month.
And yet your blood sugar was low?
Yeah.
Did you feel unwell last week?
Well, I felt really ill last week.
Have you been eating?
Yeah, I've been eating.
Yeah?
I had a big fat kebab and everything. So I was all right. The next day I woke up and it was just my blood sugar level was just as low as it was.
So we have seen in research that diabetes can be 2 to 3 times higher in prevalence in those with severe mental illness compared to the general population. Patients who suffer with severe mental illness are at risk of having poorer lifestyles. They tend to have poorer nutrition, partly because they have less income to try and afford healthier foods. And some of the antipsychotics can lead to a rise in blood sugars. So it is difficult for patients with severe mental illness. Do you drink alcohol at all?
Yeah, a little bit, but not a lot.
How much is it at the moment?
I drink 5 units a week, a day. Usually it's just 2 cans of beer that I have, and that's it.
What kind of beer is that?
It's a K-cider, which is 8.5% in volume.
Okay.
Sometimes I don't drink. I go days and days and days without drinking. Where I just literally just drink water.
Right. So you have some alcohol-free days?
Yeah, I have plenty of alcohol-free days.
Right. Good.
I only have a drink. I have a drink when I get paid, and that's it. Okay. Once every 2 weeks.
Okay. And what we will do, you're going to see your consultant, and I'd like to see you shortly after that. And then, obviously, the reason you came today, I must give you a prescription. All right?
Thank you very much.
Okay, see you soon. Okay, take care.
My daughter had an appointment at 9:30. Can I cancel that, please?
Right, now I need somebody to tell me how to cancel this, because I don't know how to do it. How do we cancel it? This lady needs to cancel her daughter's appointment.
It's going to be the easiest thing you ever do.
What did you press?
C.
Why did you press C?
Cancel.
I will get there, sorry.
OK, have a seat. Just check your oxygen levels. That's it.
I'd rather not have a bad chest.
Yeah.
You're the person to see when you put me at ease, totally at ease.
Oh, good, good.
I mean, the last time I was feeling a bit rough, and I've come out of here feeling all right,
Oh, good.
It's when I inhale the cold.
Yes, yeah.
It seems to do me no good
It
at all.
affects your chest. You're feeling up to the breathing test today?
Yeah. Well, I dread it, but you know what I mean, don't you? Got to be done.
And you don't smoke anymore, do you, John?
No. 50 a day I used to smoke.
Gosh.
Silly, isn't it? God gave me a pair of lungs. I could run cross country. I used to box when I was in. What do? I smoke 50 a day and destroy it all.
Yeah.
Crazy,
but,
isn't it?
You know, when you were young, though, nobody knew the dangers of cigarettes, did they?
All my favourite film stars smoking, so I thought if they're doing it, it'd be OK, wouldn't it?
And in the army, they used to give out the cigarettes, didn't they?
200 a week I used to smoke.
The first test is the relaxed blow.
Right.
OK, so so it's big breath in, fill your lungs as much as you can.
I'm just bracing myself for that.
Tube in mouth, pinch your nose, and then just blow out nice and slow and steady. OK, so fill your lungs. That's it. Tube in mouth. Pinch your nose. That's good. Keep going, keep going, keep going. As much as you can. Squeeze it all out. Good, well done.
Was it good? I didn't think it was very good.
Well, we'll have a look at the results in the end. So the next one is the forced blow, where you blow out really hard and fast.
As long as I can, obviously.
Yeah. Okay, so it's big breath in, remember? So big breath in. Okay, really go for it, yeah?
Yeah.
That's good. Keep going, keep going, keep going, keep going, keep going, keep going, keep going. As much as you can. Good, well done.
Was it? I thought that was rubbish. I'm doing the best I can.
Got a nice shade of scarlet when you're doing it. So we measure how much you blow out in 1 second. That was pretty much exactly the same as last year.
Yeah. Okay, good.
Your full lung capacity is better.
Really?
You blew better this year than you did last year.
Brilliant.
Last year you blew 2.96 litres. This year you blew 3.24 litres.
Brilliant.
So that's good.
When I leave here, I'm going to have a run around the block.
So you've done better than you did last year. So that's good. Okay.
Is that it?
That's it, I think.
wonderful.
Yeah. If you do have any problems with your chest, just come in and ask for an emergency doctor's appointment, yeah?
Can I just tell you a good joke? It's perfect.
Okay.
An Essex joke.
All right, go on then.
So there's a nightclub and there's a fight in this nightclub and this blonde comes out covered in blood. The ambulance arrives and the paramedic said, "Where are you bleeding from?" She said, "Romford." Thank you very much.
Very good. Nice to see you, John. Take care.
See you next year.
Yeah, take care. All the best. Bye-bye.
Yes, Dr. Hyder, come through and have a seat. And how are you?
Yeah, not very well.
Not very well. How can I help you today?
Last Tuesday, I had a phone call from Wrexham Hospital that I have got gestational diabetes. And since then, I've been checking my blood sugar.
Yeah.
Which is, results are not very good. And I phoned them this morning. I left a message at 8 o'clock.
Okay.
Nobody rang me back.
Okay. And are you on any medication? Have they started you on metformin or any
No.
medication? No. Is it your first pregnancy? Okay. So they're usually a bit higher than desired, aren't they? Gestational diabetes is a type of diabetes you get in pregnancy. It's when the pancreas is not producing enough insulin for the body's demands, so you get high blood sugars. The main risk to the mother and baby is that you get macrosomia, which is when you have a baby that is much larger than an average size. And the risk to the mother is that that will then be very difficult to deliver that baby vaginally.
Like last night, I just had salad in my dinner.
Yeah.
And it was 5.2, which was normal.
Yeah.
So this morning, I don't know why did it shoot up.
Yeah. It's sometimes just related to having the problem gestational diabetes and not because of what you're eating necessarily, because the pancreas is not sufficiently working, which is why it's not lowering the sugars enough. Sometimes you need to start some medication in pregnancy for that as well, and it's usually metformin. But what we can do is try and call the nurse now so she can see you if she's answering. Yeah.
Thank you.
How many weeks pregnant are you at the moment? 30. No, so it's the same again, answer machine. What I'll do is I'll speak to the obstetric doctors as well and just ask them if they want you to start on any medication. Hi, it's Dr. Hyder, GP calling. Could I speak to the on-call obstetric doctor for advice, please? Thank you.
Just take a seat there. Oh, sorry, is this Mum?
Thank you much. Oh, butterfingers.
Ow!
Pinch yourself.
Yes.
Oh, bless you.
I'm gonna cry.
Bye. Ow. Oh, bang me knee.
Right, how can I help?
Right, my problem is my toe. They sent me for X-ray.
Yeah.
It's come out as some arthritis. But after a whole day at work, I just find it very painful. It does hurt at night as well.
It's called hallux rigidus, is what it's called. And it's a stiffness of that joint. It can be made worse by wearing heels.
I don't wear heels.
You wear flats, yeah.
Because I work in the hospital, I'm always on flats as well.
And you're always on your feet.
Yeah.
Yeah. The only solution to this is an operation. The operation itself is painful, and it's very painful afterwards. But that recovery period lasts about 6 weeks or so, after which you're left with a stiff, surgically frozen joint here, but it's not painful anymore. But you have to be willing to have that surgery. It's not something I would jump into without sufficient thought. Unfortunately, the only other things that help are icing the joint. People underestimate greatly the amount of relief that you get from icing a joint because there's inflammation in there and the ice slows that inflammation down.
Okay, is it because I'm lacking something?
I suppose it's really a relic of evolution. All of our weight bears down on our feet, and in order to walk forward, you have to spring off your foot, and that joint takes most of the strain from the spring, and that's why it happens. It doesn't happen to everyone.
I've had bloods done recently.
Yes.
And my HbA1C was it?
HbA1c, yeah.
Has it gone up?
Yes, it has gone up. Are you taking any sugar? You're eating no sugar?
I'm eating biscuits and joy. I think that's what it was.
Biscuits have the three things in life we do not need: salt, sugar, and fat. I know they're hard to do.
I know at work, you're working all day long and then you want to treat and...
Have an apple. Have an orange.
I do apple and fruits. I love my
okay. Okay, so that's what you have, and I'd like you to read up on it on patient.co.uk.
Thank you. So just take the naproxen and do the ice treatment like you've recommended.
Correct.
Oh, thank you very much.
All the best.
Bye.
Yeah. Bye.
Okay, that's great. Thanks for your help. Bye. Yep, so they're not too concerned about the readings at the moment. They think that the diabetic nurse will be able to give you advice when you've done a few more readings. They would probably start you on metformin if you had around 3 readings above 7 before meals, which you haven't had. Gestational diabetes tends to disappear after delivering the baby. However, there is an increased risk of developing type 2 diabetes later on in life. Okay, all right, so see what they say, and if you're still not sure, then you can phone us and speak to us on the phone as well for advice. All right, take care then. Bye-bye.
Hello.
Hello.
Nice to see you.
Yeah.
So how are you?
Oh, I'm okay.
Good. You're looking well.
Yeah.
Yeah. What do you do during your days at the moment?
Today I went to Recurrent Day Centre.
And how often do you go there?
Every Wednesday.
Every Wednesday. And what do you do the rest of the week?
On a Monday, I go recycle teenagers.
You go and recycle teenagers?
Yeah.
That sounds fantastic. How do you recycle a teenager?
Drink a lot of tea.
You drink a lot of tea?
Yeah.
Brilliant. How would you describe your health?
A lot better.
Okay. Can I ask how your water works? Because in the past you've had the occasional trouble with those, haven't you?
I do wee a lot,
We actually went on a trip last Friday and he was going to the toilet a lot.
Yeah, how about night time?
About 4 or 5 and that.
You're getting up 4 or 5 times at night?
Yeah.
That's quite a lot, isn't it?
Yeah.
Would you mind if I examine your prostate? Do you know how I do that?
Yeah, okay. Was that when you put your hand...
Do an internal examination in the back passage?
Yeah.
That's right, yeah. Is that okay if I do that?
Yeah.
It would be useful for me today to do that. Is that okay? Yeah. Would you mind popping on the couch for me then, and we'll do that for you?
Do you want me to leave the room?
It's fine if you want to stay. Are you okay for wanting to stay?
Happy you be here.
Okay, but we'll draw the curtain round.
Okay.
Yes,
Okay.
curtain. Okay.
Okay, do you want to lie on the couch? That's it. Swing your feet up. Bit of jelly. Okay. Okay. Great, that's it, we're done.
Is it done?
We're done, yep. Okay, that's it. Lovely. Do you want to get yourself dressed and then come out?
Yeah.
Is that okay? So you've got a tablet for your prostate and a tablet for your bladder. to try and control that. So you're on the maximum treatment already, really.
Oh, okay.
You know,
but the prostate, you think, is just...
It felt completely okay examining you, just a bit big. I think the problem is as much with the bladder being sensitive as with the prostate.
because sometimes, I mean, I know last time that, I mean, he wants to go, but it's not a lot.
Yes.
When we're out, we drink more, don't we?
Yeah, I try and cut back.
Yeah, there's always that wish, isn't there? Because you're out, yeah.
Cut back a bit, isn't it?
Yeah.
Well, thank you for coming.
Okay.
It's nice to see you.
Thank you.
Okay.
All right.
Thanks for coming. Nice to see you.
Nice to see
Take
you.
care. Bye-bye.
See ya. You're going to be all right.
I'm going to be all right. I've survived this long. Why not carry on?
Lovely. Thank you very much, Doctor.
Bye-bye.